Hi, I'm Dr. Katayun Treasurywala. I work here in Goderich in sort of southwestern Ontario on Lake Huron. I work out of the Maitland Valley Medical Clinic, which we're in right now, and I also work across the street at the AMGH Hospital. I pair my practice with my husband, who's Dr. Paul Gill. So we share a family practice here. It's a medium-sized practice. And we also have some nurse practitioners that work with our patients as well. So we have 5 nurse practitioners out of our clinic. We have several social workers who do counseling and help people find funding, things like that. We have a dietitian, we have a diabetes nurse educator. We're actually one of the first FITs in Ontario, and so we're a FIT faux model. We are expected to follow our own patients in hospital. So when our patients are admitted to our hospital across the street, we're the MRP for them during their hospital stay. So we'll be doing both office work with you and inpatient work. We are sort of true rural family practice docs, so we do a bit of everything. I have some extra training in Emerge. I did my 3rd year in Emerge, so if you're interested, I can talk to you about that. And so I do sort of split my time between here and the Emerge across the street. Neither of us do OB, so if you're looking for that, we do have an OB program in our hospital, and people are more than willing to have someone with them if you want to be involved in deliveries. Our Emerge shifts are 12 hours long. They run from 6 a.m. to 6 p.m. Our Emerge has a wide range of acuity, so we'll have 1 or 2 really sick patients a shift on average. We do get some traumas. We are a stroke center for our area, so while we don't have neurologists, we do have neurologists sort of by webcam through the telestroke network, so that's kind of an interesting thing that you can do here. We do a lot of thrombolysis, which you wouldn't see in a city practice, because you would usually leave that to the specialist. So we do thrombolysis both for STEMI and for strokes. On a slow day, I probably see about 20 to 25 patients in the winter, but in the summer, we probably see about 35 to 40. We use Practice Solutions as our EMR. We do have a procedure room in the clinic, so we do things over in the Emerge, but we also do small procedures here.
My name is Paul Gill. I'm a family physician here in Goderich, Ontario. I do a little bit of everything, so I do Emerge work, I do some anesthesia work, and we do some inpatient work and ICU work on top of that. We are in Goderich, Ontario, so it's Canada's prettiest town, as the moniker goes. We have about 8,000 people that live in the town itself. Our catchment for our hospital is much bigger though. We've got 50,000 people that actually come to the hospital and come to our hospital more than anything else. We are truly a rural setting more than anything else in terms of what the hospital would be considered. Our hospital itself is actually quite high functioning. We are considered the stroke center for the area. A lot of the traumas that are more rural will come to us, but obviously if it's a huge trauma, most of it goes to London or to Stratford. Our hospital does have a CAT scanner and an ultrasound. It basically has all the tests that you would want other than an MRI. Is the one test that limits us. But we are the center that has the CAT scanner, so a lot of the things that are traumas or are a little bit more acute do come to us rather than going anywhere else, and that is probably why we're a stroke center as well. In terms of the role of the family doctor in the community, we kind of follow the patient from the start to the end. So the patient comes into the Emerge, we will see them there as the Emerge doc, we will admit the patient. It may be a patient that is in your own practice, and if they are, you are admitting that patient to your own care. And so after the patient has been seen and treated in hospital and you follow them in hospital, often they will be discharged and you will see that same patient in your office thereafter. So you will really get a good opportunity to see continuity of care in action from start to finish and the consequences of some of your decisions, good or bad. The distance from Goderich to some of the major centers, I would say it's about 45 minutes to Stratford. It's probably about an hour and 10 to an hour and 20 minutes to London. And that's obviously assuming you're going by car instead of ambulance. Ambulance is much quicker. So Goderich as a community is probably most well known for all of the activities around our town. We are a very active type of a community. We have lots of trails. We have a rail trail that goes from here up till Auburn. We have a YMCA, so if you have a membership at the Y, you're certainly welcome to use it, although our town usually sets up our students and our residents with access to the Y. We have lots of restaurants in town. Our square is about, I would say, about a 5-minute walk from the clinic and the hospital. The hospital and the clinic are right across the street from each other, as are residences to stay. So most people will stay at Montcalm, which is across the street from the hospital itself. Getting to Goderich is not the easiest thing in the world. We're about 2.5 hours from Toronto. So what we've offered, as my wife and I have offered, is essentially if you can get yourself to Stratford, which most people can do using either the GO transit system or there's a bus service that goes Toronto to Stratford direct. If you can get yourself to Stratford, we are quite happy to come and collect you from there. But really, other than that, there's no real easy way into Goderich itself.